Central Ohio is filled with hospitals doing amazing new treatments on the cutting edge of research. The McConnell Heart Hospital is one of the most well-known in the country when it comes to cardiac care. And tonight, our NBC4 experts give us an inside look at a new catheterization procedure gaining popularity for reducing potential complications.
We're probably up to, some people think maybe 8 or 10% in this country are being done radially. In Europe, for instance, though, they believe that over 50% of the people are being done this way.
Mid-Ohio cardiologist Dr. Anthony Chapekis says how doctors perform cardiac angiograms and catheterizations is changing. For decades, access to the heart has begun with the major femoral artery in the groin area. But more and more cardiologists and patients are opting for entry through the radial artery in the wrist. So what's the advantage of taking the shorter route up the arm?
The big issue and the concern has always been whether there's in fact ability to reduce the bleeding risk by accessing it in the arm artery or the radial artery. When we go in the leg or the femoral artery, that's much deeper and a bigger vessel, and it's harder to close and control bleeding. We also found that there was less hassle for the patient and less what we call nuisance bleeding or access site complications with the radial artery.
Dr. Chapekis says for larger individuals it's sometimes harder to go through the leg. Going through the wrist is a better option, but can be more complex and requires extra training. It might also limit access for catheterization of other areas to the body, like in the case of peripheral arterial blockage.
And many people's arteries aren't big enough to take some of these bigger catheters or tubes.
So to find out more about this new procedure, just head to NBC4i.com and search Ohio Health.
Finally,